Just a warning that this video will show late stages of this disease, and if that may bother you, then I suggest not watching. Thank you. This is Zachary. Zachary was 16 years old when this picture was taken. We made this video because we got the diagnosis of squamous cell carcinoma of the mouth, and we really didn't have a lot of resources on the internet to help us with this diagnosis. So we hope this video will help you, and if your pet has been recently diagnosed, I'm so sorry. This is Zachary. We adopted Zachary when he was 5 years old. He lived with us for 11 years, wonderful years of companionship and love. Zachary loved food, and so in September of 2022, when he stopped eating his food and looked kind of miserable laying there, we thought something might be wrong. We made an appointment with the vet. The vet discovered that 3 teeth needed to come out, and he noticed that his jaw was inflamed. So they ended up removing the teeth to alleviate that discomfort, and they did a biopsy and discovered that in the jaw was squamous cell carcinoma. There are not a lot of good treatment options for cats with SCC. So what my partner and I opted to do was provide comfort. We did not opt to get surgical removal of the tumor. It was too far spread when we found it in his jaw. So for the first 2 months, Zachary ate fairly normal, did not appear to be in discomfort, was very receptive to love. However, in December, we noticed that there might be some discomfort, so we started administering buprenorphine, which is the pain medication of choice for this disease. We started his dosing, I believe, at 2.5 milligrams, but then we upped it to about 5 toward the end of December. When you do start the buprenorphine, we recommend giving it on a fairly regular basis. It is a narcotic, and we're not sure about the effects it has on cats, and better to be safe than keep administering it than not, and have the cat who may be dependent on it and some sort of discomfort because you're not administering it. This is how we administered the buprenorphine. You kind of get up close to the cat. You want to get it into his gums, not so much down his throat, because it works with contact to the tissue. That's how the pain medication does its work. So again, not down the throat, but splashed around the gums so it can get maximum effect. If you notice in the pictures now, this is around month 3 and 4. Zachary is starting to look dirty. This is actually food that was caught in his fur as he would try to dig his face deeper into the dish. Cats start losing control of their tongue, so getting food starts to become a difficulty around this time of the disease. So what we found we had to do was have nightly washings. This would happen every time he ate at dinner, and also sometimes in the morning as well. So in the picture, we just took warm water in a bowl, a nice clean cloth, and we tried to get out all of the wet food that would get across his face. Again, as he would start to dig deeper into the dish to get food as his tongue became less usable. So he looks very happy in this picture because we are rubbing the tumor. Apparently in some cats, the tumor feels better when it's rubbed or stimulated, so he would enjoy these sessions with us. Another thing too is you may notice the hair loss on his jaw. We didn't know if this was part of the medication or if this was just from the cleaning every night, but if your cat has SCC, hair loss may be normal, especially around the area of the tumor. You also have to groom the cat a lot with SCC. They lose control of their tongue and they don't have the ability to clean themselves anymore toward the middle to late stages of the disease. So this is us just taking a fur comb and grooming him as best we can to get out the mats. It also helps get out the pieces of food that would get caught in his fur. This is us using a hairdryer to dry him after his baths. This was toward the winter and we didn't want him being uncomfortable and freezing. So one of us would point the dryer on low at him, the other would distract him with petting, otherwise he would run away. We tried to do this as quickly as possible. But again, it was winter and we didn't want him freezing and being uncomfortable after the bath. Around month 4 and 5, eating became a struggle. You notice we put the wet cat food as part of the shape of the can that it came in. This was very helpful. We discovered this ourselves, that when the food is raised and in a solid form, it was easier for him to grasp the food rather than mushing it all up and, making it lower. When it's higher, he can actually get his jar into it, and he was able to get much more food. We actually thought this may have prolonged the time we had with him, because he was able to grasp the food, otherwise he would not have been able to eat. Getting water is also going to be a challenge for cats with SCC. So we bought this water bowl that has running water. He doesn't have much control of his tongue, a little bit at this point, so he's able to tilt his head and get as much water as he can by elevating the water source and letting gravity do the work and getting down his throat. We feel this also helps prolong the time we had with him. So this video is from the late stages of the disease. I believe we have about a couple more days with him when we took this video. I would like to say this process was easy, but it's definitely not. Your cat will require a lot of care. Some pet owners choose to euthanize when they get the diagnosis. We chose to ride out the disease and see how long we could go by providing him care and comfort. So we're happy with the care we did provide him. It was definitely a challenge. There would be some nights or mornings when we'd come down and there would actually be blood on the floor, blood on his face. What happens with the disease is the cats, their jaw becomes deformed, doesn't quite align the way it used to, and so when they try to eat, their teeth dig into the soft tissue of their jaws, and that produces a puncture wound. So when that happened, we would clean him up, we would clean the floor. It was not the most pleasant experience, but unfortunately this is part of our experience, and we thought we'd share so that you know what to expect. So how do you know when it's time to put down your friend? With us, we realized he wasn't getting enough food. There was one night where he was crying, at night. He normally never cries at night, so we realized he was hungry. So the next morning, we used a turkey baster or some type of large syringe. We put in a bunch of food that was mashed up and in liquid form. We fed him that way. One of us picked him up. The other person held the turkey baster above his head. He reached up for the turkey baster because he smelled the food, and then we let gravity do the work in getting the food down his throat. So that was the final meal. We're happy that he was well fed. We called the vet shortly after that. She came. We did all the paperwork in the basement. We came up. He was asleep. We picked him up. She came behind him, put in a powerful medication to put him to sleep. He went into a deep sleep. We then had her administer the second shot, which stops the heart. He didn't react at all. It means he didn't feel a thing, so it was a peaceful passing for him. And it wasn't very easy, but it was definitely time. So in conclusion, it's not really known how cats get SCC. Some sources say that it's through wet food. Zachary only ate a diet of dry food, so we don't feel that's very accurate. He beat the odds. Most sources say cats last 2 to 4 months. Zachary lasted 6 months with us. It is a lot of work, but we're happy we went through it, and we're happy with the extra time we had with him. I hope this video has been helpful for you understanding our journey. Thank you so much for watching.